Okay, so it's about 10:05. I think we're gonna begin. So first, welcome everybody. Um, I'm Lisa Krauser, and on behalf of Greyhound Options, we do thank you for joining us for today's Learn and Greet. We're going to learn a lot about our favorite breed, their health issues, and why they're different than many other breeds, and things that as a Greyhound owner, you really should be aware of. We are really happy to be able to hold our events free of charge. But we do want people just to know, if you are interested in supporting Greyhound Options mission, we certainly are able and happy to take donations. And we made it easy. It can be done directly on our webpage, which is www.greyhoundoptions.org. We've recently updated our website, so if you haven't had a chance to check it out, you might want to do that. One of our board members, Christine Wilson, has done a lot and really making it a nice website. So with that said, I'm going to introduce our speaker, Courtney Kindler from the Greyhound Health Initiative. She's also here today with Mandy Albert from the Greyhound Health Initiative, but my understanding is Courtney's going to do the primary portion of the presentation. Perfect.
All right, so my name is Courtney Kindler. Mandy is also on here. I'll just introduce both of us real quick here. Mandy, if you want to show your face, you can. That's completely up to you. But Mandy and I have worked together for quite a few years. We started off in a general practice. We do live in Columbus, Ohio, so a little bit further away from you guys. We started the Greyhound Health Initiative Blood Bank in 2016 together. So for those of you that don't know, the GHI in itself, we try to educate on sight hounds and kind of idiosyncrasies like today. And then we also have a blood bank that helps to support the organization as well. We send blood throughout the country. So we're going to touch on some of that later on in the presentation as well. But Mandy lives south of Columbus with her husband, 2 kids, her 2 dogs, one of them being a Greyhound and one of them being a Bulldog. And she has a cat and chickens and a horse. I think I covered it all. So lots of pets. We've been vet techs for, I think she's been like 17, 18 years. So we have lots of experience in the veterinary world. I live north of Columbus and have a 3 Greyhounds. I now have 3 Cavaliers. I just adopted another Cavalier this weekend. So
Oh my goodness.
adding to the pack. And then we also have chickens here. So lots of animal experience, but with starting the blood bank, we also saw what all GHI can do for the community. So as of right now, Mandy is residing as our president and I am residing as the secretary. So there has been some changes throughout the past few years, but as of right now, we are part of that council and board members. So we're always looking for volunteers. Not that I'm going to try to poach people, but we're always looking for volunteers and people to help with Greyhounds and education as well. So I'm going to get started with this. It hopefully won't take all of 45 minutes, but it may. There's a lot of information in this. And of course, we can take whatever questions you guys have at the end of the presentation. So I'll get started with this. Some of the topics that we're going to be talking about today are Greyhound behavioral problems. As we all know, this is something when you bring these dogs into your house, some of them can come into your house and be perfectly fine, and some of them have some issues. So we'll talk about those. Within that, we're going to talk about some hot topics. So these are going to be quick, 1 word or 1 slide, just talking about different things that you're going to come across, and especially Greyhound owners are going to talk about. Greyhound blood work, why are these values so different, and what values do we need to look out for? Some of this is educating you guys so that you not necessarily can be smarter than your veterinarians, but so that you can guide them and say, hey, well, this might be different with your Greyhound. Corns, what are they? This has come up a lot, and there's a lot more Greyhounds that are getting corns nowadays. So I want to educate you about that and some of the things that Greyhound Health Initiative is also doing to try to help with the whole corns and what may or may not work. And then of course the blood banking part of things and why your Greyhounds should donate. So I do have some videos that are going to go on. Hopefully they're not going to be too choppy. So some of this is going to kind of depend on some of the internets between us, but we'll try to get through some of these videos as well. So some specific Greyhound racing behavioral problems. Now this is talking about United States Greyhound racing. So as we know, with being in this Greyhound community, there's Greyhounds that are coming from Ireland, which I know you guys are taking in. We have Spanish Greyhounds, the Galgos that are coming in. So this is not dealing with necessarily all of them. A lot of this is, I mean, it can pertain to some of them, but a lot of this is going to be from the Greyhounds that are coming from the United States. So we have lots of separation anxiety, sleep startles, space aggression, fear, whether this just be environmental as far as getting stares, TVs, loud noises, being around people, children, other animals, things like that. So we're going to get into this. I'm going to start this video so that you can see. It's a little long, so I'll probably have to skip through some of it here. But as you see with separation anxiety, this can all start the second that a person leaves their home. And there can be vocalization that goes on, destructive behavior. So if your dog isn't in a cage either, they might go through doors, they can destroy things as this whole anxiety is rising with them just from you leaving them. Lots of urination, defecation can happen, hypersalivation. These people did put a water bowl in here, which you will see this dog, it's going to dump it at some point. So it's creating a mess throughout the whole thing. I'm going to unmute it for 1 second so that you guys can hear what this dog sounds like. So we've got this high pitched vocalization that's going on throughout this whole process. And it's obviously very aggravated with being in this cage. So there's some dogs that you just kind of have to, I don't want to say give up on creating them, but we have to find other ways because being in a cage really isn't an option. I'm going to skip through some of this here. You're going to see that it's trying to escape and break out of it. The escaping part of things, especially with Greyhounds, can be very harmful. As we all know, they have very, very thin skin. So we saw a Greyhound within the past couple years that broke out of a cage and ripped the whole side of her chest open because of the wires on the cage. So this is something that, you know, can be very harmful to them and cause damage to them. So as you see, this dog won. It got out of its cage. So a lot of pacing around and things that can happen during this whole process. So we'll go to the next slide on how to correct this behavior. Over time, changing your routine is kind of crucial. There's a lot of different ways or things that you do when you're leaving the house and you probably don't even realize that you're doing them, but your dog picks up on all of this behavior. So changing your routine is kind of key with this. Lots of mental stimulation. As you'll see over here on the right, there's these different puzzle games that you can get for them. And them using their mind is very beneficial to tiring them out. So mental stimulation, obedience training, if you have your dogs do sits and stays and comes and all that kind of stuff, it's a lot more taxing for them because you're using your mental stimulation as well. So it tires them out. You could do obedience training for 15 minutes and it's like them taking an hour-long walk. So you want to tire out your dog. Also, hiring some kind of dog sitter, dog walker, or something like that, to take your dogs out in the middle of the day. Some of the time it's beneficial, some of the time it just causes more problems, but just because somebody's entering throughout the middle of the day. But some dogs do better with this. When you get into anti-anxiety supplements, drugs, things like that, you're obviously dealing with a veterinarian helping you out to get through the separation anxiety process. So you need to, have them on board with getting that. Now, that also comes into play with your veterinarians knowing greyhounds, because some of them may prescribe different medications, and not knowing greyhounds, they might need to lower that dosage of medications because they're so sensitive to different drugs. We'll get into some of that a little bit later, but just so that, if you are giving your animal medications, that can happen. Also, and I'm only going to say this for greyhounds just because I've seen it so many times, that for some greyhounds, they have to have another dog, whether that being another greyhound or another dog in the house in general. They thrive together with other dogs. There are some of them that do very well being on their own, but there are just some of them that they need that other dog to be around. I wouldn't recommend that for every single breed of dog, but just with fostering, there's some dogs that we've had to, pull from houses, and then we put them in with another dog and they're completely fine. So just some different ways to correct things. Sleep startle. This is kind of saying, let a sleeping dog lie. So just like a baby, let a sleeping baby lie. So sleep startle is when your dog suddenly wakes up all of a sudden. So whether this be somebody touching it, it could be a sound, things like that. Sometimes the sounds or calling out their name can be better, but some of the time they will have an aggressive response. So they may come at you, they may try to bite you. So waking your dog up if they suffer from sleep startle beforehand, so that there isn't that aggressive response. Making sure that these dogs have a safe environment to sleep in. So putting a bed in the corner of your home so that there's not somebody that's walking around them or another pet that's walking around them. You want to make sure that they have that safe spot. Being on a couch or sleeping in bed with you is probably not the safest thing for them or for you. And all family members need to be on board with this. So you have to know what the dog is going to do and how to live with that dog. So you have to be mindful of them with being in your home, and you can't just run up to them. So especially with kids, some of these dogs are harder to place because of having this. We get into space aggression, toy aggression, food aggression can fall under this as well. I am very lucky enough to have one of these dogs in my house as well. So they can suffer from a lot of this. My personal dog, he only does it with other dogs. So we're fortunate enough that he doesn't turn and it doesn't react to us with these types of things. But you need to know what their triggers are. What kind of toys set them off? What kind of toys do they become possessive over? Making sure that there's a secure place for them to be. If we want our dog to play with a certain toy, he gets to play with himself in a room, and that's how he has to play with that toy, with none of the other dogs around. So you need to establish this place and where it's going to be. There are a lot of times that it's harder for these animals to live with other dogs, with children, even sometimes with adults. So it just, it kind of depends. You have to know what to do with these dogs and how they want to live their life. So also fear. I'm going to play this video. This dog has compensated for how he's going to figure out how to walk up the stairs. But these dogs don't know what stairs are, most of them. This flooring that these people have, this wood flooring, also that kind of floor can be super fearful for these animals. And they need carpets and runners and things like that throughout the house. So trying to figure out teaching them how to live. So environmental type fears, also being around people. They're around people, as we know, on the tracks, but are they around children? You know, some of them are, some of them aren't. Cats, dogs, meaning non-greyhound type dogs. We've had, you know, a lot of dogs that are necessarily, they're great with greyhounds, but they're not great with other dogs. And then you get your thunderstorm phobias, your loud noises. And some of the time these can provoke a fight or flight stage or even freezing. So if they, as we know, a flight stage would be them running. And unfortunately, if the dog's outside, then we have a greyhound that's run away, which is never easy to deal with, and it's fearful. So these are the types of fears and getting them used to life at this point in time. So here's two of my boys that I adopted. Dig is on the left. He's my toy aggressive, space aggressive, food aggressive dog that I was talking about. So we've dealt with all of these problems. And then Scully, he is actually like the perfect dog. He was returned to us at 6. We adopted him. He's now 11. Didn't really have to go through much with him. So you adopt these wonderful dogs, you bring them into your home, you get through all of these behavioral problems. And then it's like, oh my gosh, these dogs are great. But now you get to deal with a whole bunch of other idiosyncrasies and things that we're going to talk about here. And you think, what did I adopt? An alien. This is what we call them in our world. There's so many things. Even Dr. Kodo, many times they are the aliens of the canine world. So we're going to get into these short topics, these hot topics that we're going to call them. First off, being the weight of your greyhounds. You've adopted them, and most of the time they're going to come to you looking like they do on the left. This is what we call the racing weight of a greyhound. It's usually about 5 to 7 pounds lighter than what a typical greyhound is going to be. And then you have your very obese greyhound. So this dog was very loved throughout its first probably month or 2, maybe 3 of getting into this home and getting lots of food. So we're going to talk about ideal weight of your dog. This was kind of one of the best pictures I could find. It was hard to find pictures of an ideal weight of a greyhound, especially being all the things that I want to talk about. It's a brindle color, so it's a little harder to see with things, but you can kind of make things out. You want to see the last few ribs of your greyhound. You can kind of see more of his ribs, and most of it's just because of the way that he's turned, but you can see these ribs over here. A little bit of the top vertebrae, which you can kind of see sticking up here. And then you want to see a prominent hip bone, not too prominent, but you do want to see their hip bone. So as you can see, if we go back for 1 second, this dog, you're seeing a lot of his ribs. His vertebrae is kind of harder to see in this. And then up here, you see a lot of his hip bone. So we can see that he needs to gain some weight. This one, there's no ribs. I promise you these aren't ribs. It's just the way that the brindle is looking on her. And then there's no hip bone, there's no vertebrae. So you want to make sure that their kind of overall look is going to be like this. So every single dog is different. As we know, there's different breed standards for every single dog. In the veterinary world, we go by this chart. So you may even see when you go to your veterinarian, they have their annual exam, that they get a score. And we're going to put a score on them. It's usually, we'll say like a 5 out of 9, meaning that your dog is at this ideal weight. So Of course, it's a lab in this picture and it's going to look a little bit different than this, but most of the time when I'm looking at a dog at work, I'm looking over top of them because this is going to kind of see what this dog looks like when you're over top of them. Obviously, if your dog looks like this, it's going to be an 8 or 9. We call them Ottomans when they come in, and it's like, well, that dog looks like an Ottoman. So it's way too big. And when they're completely emaciated, you know, it's a 1 or a 2. And unfortunately, with some neglect cases and things like that, this is what you see. But ideally, you want your dog to be a 4 or 5. And with the Greyhound, those are the characteristics that we will look for with that. Hookworms, I'm going to try to be, I don't want to say as brief as I can. This is a huge topic in the Greyhound world, as we know. So almost every single Greyhound that you're going to get off the track in the United States is going to be prone to resistant hookworms. Unfortunately, this is something that's happened over time with some studies that have gone on, and the best treatment that, you know, being in the veterinary world that we found is giving some sort of monthly preventative. So this is your monthly heartworm preventative that you're giving that has moxidectin in this, in the ingredients. There's a lot of different monthly preventatives for your dog. So you want to make sure that it has that moxidectin in it. And then in conjunction with that, you're going to do some sort of other dewormer. Some people might do 1 in the beginning, and then they might have to do 2 in the beginning. So giving this monthly dewormer at the first of the month, maybe doing your Dronto Plus on the 2nd day of the month, and then your fenbendazole, which is like your Panicure, things like that, on the 15th of the month. But as we know, this is a huge problem. Don't waste your money with running fecals all the time. It is a waste of money. So get on some type of protocol. Make sure that your veterinarian is on board with this. And I mean, even ourselves, we've had people bring in articles and say, hey, I found this article and I would like to try this to try to get rid of them. And I mean, most of the veterinarians can be, I guess, agreeable to that and help you out with this whole process. There are some dogs that don't have any symptoms at all. Maybe the soft poop, that's about it. But, you know, there's a lot of them that are living with these hookworms. So my biggest advice is to get on the protocol with your doctor, whatever that may be. Checking a fecal maybe after 3 months, 6 months, something like that, but don't be running fecal after fecal after fecal. Most of the time they are suffering from some type of hookworm, and just trying to get rid of them as fast as you possibly can. Some of these dogs, it takes a year. So that's my lecture on that. Sedation and anesthesia. So for years and years and years, it was, you know, oh, sedation and anesthesia is scary and you shouldn't do it. So a lot of drugs that are out there nowadays are very safe for your Greyhounds and your Sighthounds in general. I'm going to skip down to thiopental. Was a huge drug that was very not safe for Greyhounds. This drug is no longer used or even made in the United States anymore. It hasn't been made for probably the last 5 to 10 years. So with that being off the market, and it makes things a lot easier. Now, as I said before, Greyhounds are sensitive to drugs. So opioids, like your fentanyl, your morphine, your hydromorphone, those types of drugs, they are more sensitive to them. So your veterinarians need to know about those types of things. Also propofol, which is used all the time in veterinary medicine. It's what we call an induction agent. So this is how we get them to be able to place a tube in them, put them under anesthesia. This particular drug, it's a fat soluble drug. So when you think about this as being fat soluble, it binds to fat, and greyhounds have no fat. So it can make for a little bit prolonged recovery with them. So not using a ton of it can be very beneficial to your greyhounds. The anesthesia part of things. So you've decided to put your dog under sedation or having a anesthetic procedure done. So you want to make sure that your veterinary clinic has the monitoring equipment that you should have, is monitoring appropriately. So these are, you know, you see these in hospitals all the time. We're going to be monitoring heart rates, blood pressures, respiratory rates, those types of things. These little sheets up here are what the registered technicians, that's also a big thing, having a registered technician. So somebody that went to school for this type of stuff. Believe it or not, there's many states that are out there that you don't have to be registered. So you could not have any schooling and you can be putting animals under anesthesia. So we keep track of everything on these sheets. And we have the anesthetic machines that we're using. Most clinics are going to use isoflurane. There is a type of gas that keeps you under anesthesia. They can use some other types of anesthesia gases, but that's most commonly used. And very briefly, I'll talk about just potassium monitoring at the particular clinic that I work at. This is very important. There was an article that came out, I want to say it was early 2000s, but it was basically about monitoring potassiums and especially sight hounds and greyhounds for some reason. And there's not very much clinical information as to why, but they will increase their potassiums the longer that they are under anesthesia. So you may have this greyhound that has horrific teeth, and it's going to take multiple extractions. It's going to be under anesthesia for a long period of time. These are the times that you want to be checking the potassium. They can spike their potassiums, and at that point in time, you want to get them quickly up from anesthesia. There's no way to, you can try different things to decrease their potassiums, but once they get so high, the best way to get things back to normal is to wake them up from anesthesia. So at the particular clinic that I still work at sometimes, we do, they might have a couple anesthetic procedures. So we're going to do one half of the mouth. We're going to let things heal. And then maybe 2-3 weeks later, we're going to do the other half of the mouth, because we want to be aware of that anesthesia time that these dogs are under so that it's not harming them. Dental care. I'm going to show you some really gross pictures of some teeth here. And if you don't like to see this, you're going to turn your head for 3 slides. So as we know, greyhounds have horrible, horrible, horrible teeth. The one thing that they don't get is, you know, arthritic joints like hips and things like that labs get, but we get these disgusting teeth. So if you do not take care of your greyhound's teeth, you're going to have all of them extracted. Unfortunately, some of them come to the rescues, you know, especially if you have a good racer and they're 5 years old and their teeth are already disgusting. And, you know, this is something that we have to deal with, but keeping up with that once the dentals are done. So you want to brush their teeth. You want to use, you have these toothbrushes, finger toothbrushes, all different kinds of flavors. I know that we like to have our dogs smell minty fresh, but my dogs do not like mint toothpaste. So you may want to pick the poultry or the salmon or something like that. So trying to keep up with your dog's teeth. Yes, you should brush them every day. I'm probably the worst compliant client when it comes to stuff like that, but ideally you should brush your dog's teeth every day. And for these types of dogs, doing yearly or every other year dental procedures is definitely should be on your radar. So we're going to get into blood work. And with the blood work, these are the cards that we have. I'm sure that some of you have seen these cards. We're going to be updating them here. I'd say probably by the beginning of the year. We've had some different values that have come up that over time in different studies that have been done, some of these have changed a little bit. But overall, these are things that are different about your Greyhound. So they're always going to have a lower white blood cell count than normal. They're going to have lower platelets. So your platelets are what you use for your clotting factors and things like that in your blood. Your BUN and creatinine, these particular enzymes are what your kidneys, what we use to look at kidney values. So these are always increased a little bit compared to normal dogs. Your total T4, so this is your thyroid. When doctors think that there's something wrong with the thyroid, this is what they're going to test. In a lot of Greyhounds are very, very, very low compared to some dogs. And then your PCVs run a lot higher than normal dogs. Most of the time we will have dogs that come in to donate and their PCVs are around 70. And for most, normal canines, that would be a dehydrated dog at that point. And with Greyhounds, that's just very normal. So these are things, we have these cards that we have people, purchase or donate to us. And so they're always available to have. So in with this, the SDMA has come out within probably the past 5 years. So the SDMA, this was a test done through IDEX labs. I'm not sure. I know IDEX is very prominent in that area, but with what lab your veterinarians are using. But the SDMA helps to detect early detection of kidney values. So over time, you may have completely normal blood work, but then your SDMA value might come back a little bit high. It might come back at 18 or something like that. And so at this point in time, they are finding that this is a very good indicator of early detection for kidney disease. Well, here's the problem, because we have Greyhounds and they don't ever read any book as far as their blood values. We have people that will email us all the time and say that their Greyhounds have gotten diagnosed with kidney disease. So I'm going to go back for 1 second. And let's say that the kidney disease, we have a high BUN and creatinine. And with that high BUN and creatinine, let's say your creatinine's at 2.0. Like I said, we're going to change these because now our high value of this is actually 2.1. So we might have a creatinine of 2.0. Our BUN might be 28. And then our SDMA might be at like 17. So on paper, this dog is going to look like it has kidney disease. And if we go by the values of the studies that they have done, not saying that it doesn't, but these are pretty normal values for Greyhounds. So we can check other things like how concentrated is our urine. That's a pretty good indicator for veterinarians as far as looking at urines and are they concentrating their urine, because this is what your kidneys do, depending on how much water you're drinking, that types of things. So not saying that your dog doesn't have kidney disease, but these are things that you want to look for. T4s, the thyroid is another thing. If your veterinarian, sends out a T4, and let's say these aren't necessarily the values that we use. So like a normal T4 is like for a Greyhound is at 0.5 to 1.7. For a normal dog, their low is at 1. So if they come at it as 0.7, they're going to say, oh, your dog has thyroid disease. And it really doesn't. We see Greyhounds all the time that are on thyroid medication that should never be on thyroid medication. So just things to be able to help your your veterinarians out with looking at greyhounds, just like this card says, if 50% in a greyhound can be anemic. So trending over time, hopefully you guys are getting blood work done on your dogs, and especially when you have older dogs, and being able to monitor and see what values have changed over time. You will see some of the time your PCVs drop if you are doing blood work over time, and you could have a PCV of 68 the whole time, and then all of a sudden you go in and it's 50. Well, for your dog, that's anemic. So you need to be able to follow those trends for your dogs. So we're gonna talk about limping a little bit. I'm gonna show you this video. I'll probably have to show it a couple times just because of how short this video is. But all of us have this fear that when we see our dogs limp, that, oh, that was really short. That when we see our dogs limp, that we automatically think the worst. I'm just gonna try to change your frame of mind for a little bit here. And as you can see, this dog, it's a little blurry, but she's limping on this black back right foot here. And all of us always think the worst with this. So let's try to think about something else. We're gonna think about corns. So especially in the past few years, I feel like we've seen a ton of dogs that have had corns. They all kind of look like these pictures. They're these hard pieces of keratin that make it very painful for the dogs to walk on. So if you think about it, it's basically like stepping on a pebble and walking on a pebble. You're going to see these dogs limp. Some of them will become 3-legged dogs, even just from having a corn on them. So a couple of treatments of corns. Pretty conservative management of them. We can file down the area of the corn. They can wear these funny looking boots. You've probably seen greyhounds with boots on. Lotions, creams. We were just talking before this all started about how many different products are out there that people have tried as far as dissolving that corn or softening it and making it easier to haul it out. But some of the time you need regular applications of these treatments. This is kind of a long video, but this is, most of the time this isn't going to be done like this, but we have hauling procedures of digging out this corn. You'll see this veterinarian that's digging out this corn on this jog. This isn't a very prominent corn that he has. Most of the time when we're doing this at my job, we have the dogs up on the table, so they're laying on their sides. Some of the time they'll use some type of a local block on them to make sure that there's no pain or anything that's going on while they're doing this. There's a lot of dogs that do not need to be sedated for this. Greyhounds can be pretty stoic, and so they're not painful when you're doing this. So there are dogs that don't like their feet touched. So yes, those particular ones we will have to sedate, but they're just using a dental elevator. Actually, this is what you use to take out teeth, and hauling up underneath that corn and being able to get off that corn that's on there. There's some of them that'll go very, very deep into their paw. And so it'll make this big divot in their paw. And so you actually have to use a Dremel or some sort of file to kind of get all of the rest of the roughness off of them. So hauling is a big thing. I know that there's even some owners that do the hauling procedures at home, as long as you're comfortable with doing that. But that is one of the treatments. Full amputation is another treatment of this. So this is actually taking off this whole digit from the animal. You'll see here, this has to be on a non-weight bearing toe. So on your dogs, these two middle toes are weight bearing toes. So they really need these toes to support the weight of them. So some of the time, if it's constantly getting the same corn in the same toe on the same digit, same spot over and over and over and over again, this can be an option for you. If it's, hey, I have this corn on this toe, but then you have a corn on a different toe, you just can't keep taking toes off. So you have to see, you know, what are we trying to treat, and each dog can be their own individuals with this. So amputation is sometimes an option for different dogs. These are kind of some gross pictures. I probably should have told you beforehand, but we have another treatment that this is kind of where GHI has been trying to help out with. This is a very new procedure. So it came out probably 2018 or so, they started doing this. So these are the tenotomy surgeries. There can be a deep tenotomy or a superficial tenotomy done. This is taking, you'll see on this picture, this is taking this digit right here, has this corn. This tendon is the one that runs up the foot. So what we're trying to do here is to alleviate pain. So a lot of dogs, you might go through hauling out of the corn a few times. They're constantly on pain medications. They're still limping. These corns are coming back. So over time, after doing usually a couple different procedures, most of the time we're not going to jump to doing these types of surgeries. But if this keeps happening, we will recommend doing the tenotomy surgeries. And so they will cut this tendon. So this will alleviate the pain that the dog is having. And it'll actually kind of flip that portion of the paw upward. So they're not putting as much pressure on that paw either from that tendon. The procedure, like I said, it can alleviate pain. So GHI has been trying to fund a study in the UK that's assessing the long-term biochemical effects of this. So since this is a new procedure, if you have a 5-year-old dog and you do this maybe on 1 or 2 digits, depending, because it can be done on multiple digits, what is this going to do over time? Is the dog going to walk differently? Is it going to disperse its weight differently? So these are the things that they're going to be looking at. We have Professor Comerford, Dr. Bates, and Dr. Gilliard are conducting this study, and it is fully funded now. So we are going to help continue this process and getting updates from them throughout the time. So if corns are something that you are dealing with on a all the time basis, then this is definitely something that you should look at. We also had a corn symposium recently. This is the QR code if you want to know more about corns that we had. There is a fee for this. All of the money has gone to this study. So we, like I said, have been trying to help them out with this and figuring out what to do with corns. This isn't just in the United States. This is throughout the world. These dogs are very, very prone to this. So unfortunately, we have to go on the other side of things. And I'd love to say that every single dog has corns. But unfortunately, as we know, greyhounds are very prone to osteosarcomas. So this is bone cancer. It can be really anywhere in the leg. So we might see it. This is in the carpus area of this dog. This is very extreme. I'm sure that most of you are not going to get to this point that your dog's leg looks like this, but you will see in this x-ray as well, all of this bone kind of looks eaten out in this area, and that's what it'll start to look like on an x-ray. Just to kind of go back for a second, Dr. Cotto does a lot of consultations as well. And he has seen multiple people that will go in for visits at doctors. They will get sent for MRIs. They will get sent for all of these things. And the only thing that they really needed to look for was the fact that the dog had a corn. So they have paid $10,000 to get diagnosed with corn. So just something for you guys to look at, because I know automatically we always think the worst and we're thinking cancer. So start thinking corns before you think cancer. Anyways, briefly on bone cancer, I don't like to talk too much about it because I know there's a lot of other stuff out there about it. But once your dog is diagnosed with it, this is also a very horrible x-ray of bone cancer. So these are going to be x-rays that have been, it's probably been an issue for a little bit longer of a time. So the bone's already eaten out at a lot of the bone here. This leg could probably break here pretty soon. So treatment for this, amputation is usually the preferred first thing to do. If you do nothing with them, and of course you have to think about your dog. So if your dog has even other corns, let's say, and it can't walk properly, or it has back problems, things like that, amputation might not be even a candidate for your dog. I know that some of the time age is going to become a factor for these dogs as well. So if you do nothing, you're looking at approximately 2 months of survival time. If you do just amputation, you might be around 4 months. And then doing the amputation and the chemotherapy, which is the ideal method of trying to do something with this, it's usually about 12 to 18 months. Of course, we see the dogs that survive for 3 years. And of course, we see the dogs that might survive for 3 months. They don't always read the book on this, but this is basic survival times for dealing with osteosarcomas. One of the key things is pain management. These dogs are in a lot of pain. So even when we do the amputations, you're going to see a lot of that pain subside because that leg doesn't hurt anymore. So these dogs feel great with the amputation once they're recovered from everything because it doesn't hurt anymore. So if you decide to do nothing, the pain management has to be one of your key things with keeping these dogs comfortable. So that's about all we're going to do on limping. Last topic we'll go into is blood banking. So like I said, Mandy and I started this blood bank back in 2016. We send to so many hospitals around the country. We're usually on like a 5 to 6 waiting list. Right now it's a little bit lower than that, surprisingly. But we take blood from, these are all owned by people, all of these dogs in our program. They do not have to be greyhounds. As you can see, this cute little golden retriever over here is one of our donors. The dogs have to be healthy and in between 1 and 7 years of age, over 50 pounds, a pretty calm demeanor. Now, when I say that, your dog has to lay there, but we have lots of pit bulls, especially, and even some of our greyhounds. I mean, some of our greyhounds come in, they jump all over us. They're so excited to be there. But the key thing is that once they calm down, they do lay on a table for about 5 to 10 minutes with minimal restraint during this whole process. The benefits of being in our particular blood bank is they do get year-round heartworm and flea and tick preventative. So as you know, this is a pretty costly thing, but we need to make sure that our dogs are staying as healthy as we possibly can. It's up to the owners to hopefully give that medication every single month, but we are providing that for them. And the other commitment is them bringing it in every 2 to 4 months for donations. So just like us, dogs can donate about every 2 months, every 8 to 10 weeks ish, and donate their blood for us. So in your area, I'm not sure where there are blood banks around, but asking your veterinarians, hey, where do you get your blood? Some veterinarians will also just have different donors that they use, that they might call in extreme cases and things like that. So asking around in your area is always great. For this screening process, everything is free. So we have a doctor's exam, we collect blood, we do weights and TPRs on them, we make sure that everything is healthy with them. We test them. Dogs do have different blood types, just like we do. So we do test them for these things. And then we want to metabolically make sure that they're okay. Are they okay to donate? Is there anything that's flagging us? So Dr. Kodo looks at all of our blood work on every single patient that we have. He's such a guru at that type of stuff. So we send that all to him and make sure with him, everything looks fine before we're going to take these dogs' blood. So this is a typical day for us. These pictures were taken quite a while ago, so Mandy and I might look a little bit different now. But this is Pharaoh. Pharaoh was one of our very long time donors. He's still a donor with us, but he is getting older over time. In this process, they can donate till around the age of 10. And most of them do. So we clip and clean their neck, make sure that everything is sterile when we are putting the needle in their neck. Some of these pictures are kind of gross. If you guys don't want to see them, then please turn your head. We insert the needle into their neck after it's clipped and cleaned. This is Bert. This is his brother. Bert is since now retired. He was a little bit older than Pharaoh. But we insert the needle into their neck. And then this is the blood that's actually coming down off of the table. We use gravity for all of this. So there's no pumps or artificial pumps involved. This machine right here, it will mix the blood for us, and then it also measures it. So we can see we're at 53 mLs here. This is like the beginning process of everything. And we want our target to be around 450 for every single dog. So we take 450 mLs of blood off of them. It takes about 5 to 10 minutes. Now, when you're talking about these greyhounds that have a high PCV, like we talked about, it's going to take longer. So, which is great because most of them are good at sitting on the table, and they give us lots of blood. So this, this process takes about 5 to 10 minutes. After each donation, they get a big bowl of food. You'll see on them that they have these neck wraps on, which is very typical. They'll leave those on for the next few hours just to make sure that there's no bruising or any kind of, we want to make sure that it's being held off in clotting. So there can be some bruising, just like if you think about when you donate blood, especially on white dogs like this, you'll see the bruising even more. I feel like we get more phone calls on the dogs that you can see a little bit better, but they can have bruising as long as it's nothing too traumatic. So then we take this blood, we separate, we centrifuge it, which is going to separate our red blood cells from our plasma. I'm sure that most of you have heard as far as like you could donate plasma, which in the human world, it's not the greatest thing to do, but we will put this in here and then we get these two different parts. This is what it looks like when it comes out of the centrifuge. When we separate down here, this is what we call our packed red blood cells. So when somebody has a blood transfusion, this is the part that they're getting. This up here is your plasma. So we have dogs that may have clotting disorders. We have dogs that may have protein losing disorders. A big thing nowadays is parvo puppies. They will use plasma to try to, that'll transfuse and help them get through using or dealing with the parvo. So these are the two things that we separate in our blood bank. We also put a preservative in the blood, which is in this bag. This is all, we're not taking these bags apart, so everything is staying sterile. And in this preservative, it helps for the blood to stay for the next 6 weeks. So when somebody purchases blood from us, it can sit in the refrigerator for 6 weeks. before they use it. And we sell different bag sizes. So there's small, medium, and larges, depending on what they want to purchase. All of it, like I said, is sold throughout the United States. And really any veterinary clinic can buy it. The fresh frozen plasma that we have will last for up to 1 year. So it can sit in their freezers for up to 1 year and still be fresh. This is what we're donors too. So they're superheroes, as we call them. In 2021, we sold 780 bags of packed red blood cells and 325 bags of plasma. I'm sure that when we do 2022's numbers, they're going to be more than this. So potentially for every bag that we sell, saves one dog. So that's approximately 1,105 bags and that our donors have saved. Typically, like I told you, the waiting list is about 5 to 6 weeks. We're out to about probably 2 weeks right now, like I said, which is not very typical, but I'm sure that will change with the holidays right around the corner. So having these dogs, it's very crucial. If you have a donor program in your area, I would suggest to check it out if your dogs meet those requirements that I talked about previously. So this is about all I have. I think that went about 45 minutes. These are some of our donors that we have too, all different breeds, sizes, but all the cuties that we have in our blood bank.
Thank you so much, Courtney. That was really amazing. A ton of information.